Do you know what your COVID story will be? When a major event that impacts a number of people occurs, we have a story. For those of us who are old enough to remember 9/11 well, we know exactly where we were and what we were doing, how we felt, and what that event meant to each of us. We're obviously in the middle of another type of event with COVID for which we will all have stories. For some, these stories will be light and funny, right? I'm personally following the adventures of our aspirational bakers and what they're doing with sourdough bread. We'll be continuing to hear all the ways in which our Zoom meetings go sideways. I hope we get to continue to meet all of the cats and dogs and children of our colleagues in our virtual work meetings. I think that's great. And yet we know that not all stories are going to be this light. Many of them are heavy because that's the global story of COVID, of suffering and of death. And for too many people, the story about the pandemic will be about their mental illness. Not everyone tells stories about their mental illness because unfortunately there's still too much stigma attached. And yet we know that COVID has wreaked havoc with our mental health. Our young people in particular have been very hard hit. 63% of 18 to 24-year-olds have experienced anxiety or depression in the last year, according to the CDC, and many are thinking seriously of suicide. There are other indicators of a mental health crisis that's unfolded over the course of this pandemic. This was predicted. But unfortunately, this mental health crisis didn't occur in the context of a well-resourced mental health care treatment system. Prior to the onset of the pandemic, our resources have been stretched too thin. So we need to invest in more mental health care resources. And we know that our ability to respond to mental illness is not the only answer. We have to invest in prevention. This is the reason many universities, including Mason, are partnering with programs like JED Campus, which is a program of the JED Foundation, to implement a public health approach to the prevention of suicide and serious substance abuse. We know it takes a concerted, collaborative effort by an entire community to create a culture of mental health. So we know one of the major stories about the pandemic will be about mental illness. And we know that a major contributor to mental illness is social isolation. And hasn't that been part of our experience in the last year? Of necessity, we've been isolating from each other. And many of us have experienced the counterpart to isolation, loneliness. We need to feel connected with each other in order to have emotional well-being and to have a sense of belonging. One of my great colleagues, Dr. Van Bailey, in talking about well-being, noted that inclusion is an essential component to well-being. And in describing this, they described inclusion as the experience of feeling one's stories belong. Now, what they were describing was the experience of many historically underrepresented students on college campuses who often feel that their stories don't belong. They're a population very vulnerable to loneliness. So we have to address loneliness in order to create a culture of mental health. And how do we do this? We connect with each other in a way that's accessible to all of us through our stories. The power of storytelling is immense and well known, right? One of the reasons that therapy is effective is because it's a space where we can tell stories that we don't want to or can't share anywhere else. As a therapist and as a coach, I've had the privilege of bearing witness to many people's lives through the stories that they chose to share with me, and have seen the profound healing that it can occur from that. There are effective, evidence-based treatments that focus on storytelling. When we share our stories, we work through our feelings around a difficult experience. We find new meaning. And when we share our stories with interested and compassionate listeners, we feel seen, and we feel heard, we feel less isolated, and we feel less lonely. But we don't always tell our full stories outside of a therapy room. And why is that? Well, there's so many reasons. One is that we can get in our own way. Despite the fact that we want to connect with each other, we sometimes trip ourselves up. I might be, for example, trying to share an experience, a difficult experience with a friend, and my friend isn't in a space to provide empathy or validation. And in fact, their response is more of disconnection and maybe even competition. They assure me that they wouldn't have gone through the experience that I relate because they're not vulnerable to it. They feel like they've figured out something that they think I might not have. So although that's a self-protective response for my friend, it's isolating for me. And I might be in a moment when my friend is trying to share a story with me, but I'm preoccupied. And so I don't spend enough time with my friend and their story, and I use it instead as a launching pad to detour to my own narrative. And then my friend is isolated. So we try to connect, but sometimes we trip up. And then, of course, there's the pressure to tell the kinds of stories that we think other people want to hear. We do this on our social media platforms all the time. We don't share our full realities on Facebook and Instagram and Snapchat. We use our filters. We know that. One of my favorite thought leaders is Susan David. She's a psychologist out of Harvard, and she talks about the pressure that we feel to express positivity even if we don't feel it. Can you imagine how hard that is for somebody who's depressed? If I'm feeling cranky or out of sorts or down, I might not say it that way. I might say something instead like, I've just been so tired, or I've been really busy, because that's what's comfortable for people to hear. So we minimize how we feel in order to make our listeners comfortable. We know that often people prefer expressions of positivity and resilience. I might even tack on an expression of gratitude that I don't feel because we know that people like to hear that. Now, the practice of gratitude is very powerful, but if we don't feel it, then we can misuse expressions of gratitude in ways that Susan David reminds us will diminish our resilience and undermine our sense of reality, make us more fragile. Now, I'm not saying that we should only share our painful stories. We should connect around all of our fullness, right? All of our joy and our funny anecdotes. And we know that not every setting or situation or relationship is safe or appropriate for all of our full stories. But the question that I'm sitting with is, are we sharing our full stories with anyone, particularly if they include mental illness? And how often are we trying to connect, but we get in our own ways? And how often do we edit our stories to make other people comfortable, but in ways that maintain our isolation? I'm going to share one very quick story with you about my experience in COVID, and it's not one of my harder stories. I chose an ordinary story, and I chose an ordinary story because I know that we often hesitate to share ordinary stories in extraordinary times because we're comparing our experiences to all of the suffering and loss that we know is out there. And sometimes we judge our own experiences as not worthy of attention. But if we can't share our ordinary stories, then we can't have everyday connection. So my very quick story is that I'm a runner, and I've been a runner for many years. I've run many races. I don't win any of them or come even close, but I love it, and I love training. I train sometimes by myself, and when I'm running by myself, I'm in my head, and I'm solving all kinds of problems because I'm just negotiating with myself, right? Or it's very peaceful. And sometimes I'm running with friends, and when you regularly run long distances with friends, you have to get into substantive conversation. We're sharing our stories. And then there's the phenomenon of emotional running, which is great. You can recognize emotional running when you see the speaker/runner who is outpacing an entire group because they're running and talking and crying at the same time. It's very cathartic. So running has meant many things for me, including that it's been an important support for my mental health. But in the last year, I've not been able to run much. And that's been an accumulation of injuries that have thoroughly sidelined me, despite the fact that I've resisted that. And so my worry is that I'm not going to be able to run again in the way that I used to. Now, doing my own work with myself, I have recognized that that's not a helpful mindset. So I'm currently inspired by Simon Sinek, who writes about the infinite mindset, which includes finding opportunities for growth in our challenges and finding the greater meaning for what we do. And so if I apply that mindset to my situation, then I don't ask the question, how will I get back to my old reality of running? More, how do I change so that I live my life fully, whether I'm running again or not? And how do I find the greater purpose and why for running and achieve that whether I'm running or not? Now, when I tell this story, I am tempted at times to gloss over how strongly I feel or to declare gratitude preemptively. And in fact, I do feel gratitude for all of the abilities that I have. But the gratitude declaration is because I'm concerned somebody else will point out the silver lining of my story to me. And that feels invalidating, and it feels disconnecting when I've been actually looking for connection and support. If anybody hasn't seen Brene Brown's video on this that has a fox and a bear. It's all about empathy. I do recommend it. But the point of it is, when we share our stories, we want empathy and connection. So to bring this back to mental health, we know we need resources for treatment, and we need a lot of them, more than we have now. And as individuals, we can play an active role in creating a culture of mental health by mitigating loneliness. We can share our ordinary stories and our extraordinary stories in ways that model emotional courage. We can signal that you don't have to be positive all the time in order to make me feel comfortable. I want to hear all the stories. And we welcome all stories so that everyone feels like they belong. And we don't compare somebody else's story to ours or to somebody else's or judge it as unworthy. And particularly if the story is about mental illness, we really welcome that. Because it's not like those stories are unusual. We just don't hear them enough. And if we make space for stories about mental illness, we may be the catalyst that help connect people to the support that they need. So as individuals, there is a lot that we can do to mitigate loneliness and create a culture of mental health. But we can also leverage this into systemic change. Jed Campus knows this. They've identified social connectedness as a key factor in the prevention of suicide and serious substance abuse. Universities are investing in initiatives that promote inclusion and belonging because we know it improves retention, but it also saves lives. There are brilliant solutions being adopted across the globe to tackle loneliness that I think should catch fire. One of my favorites is from Zimbabwe, a psychiatrist there, Dr. Dixon Chabande, who tackled the massive shortage of psychiatric care in his country by leveraging the power of grandmothers and friendship benches, and saw reductions in depression. We are lining up for vaccinations, hopefully to see fewer deaths from COVID. If we can invest in more solutions to loneliness to create a culture of mental health, and if as individuals we can commit to creating a culture of inclusion by sharing and embracing all of our stories, especially if they're about mental illness, then we can save even more lives. Thank you.